I know that we've had some contact recently from people with questions around the merger of the 5 Workington GP practices. So I thought I'd take this opportunity to try and answer some of those questions using information from the North Cumbria Clinical Commissioning Group. Depending on your needs, you might well see your own GP. However, it might be necessary to see someone different. A fully integrated primary care model is about patients seeing the most appropriate clinician and the person with the most expertise in that particular area. The model is about people seeing the appropriate clinician, so it might well be that you need to go to a different building to the one that you're used to. However, as all the GP sites in Workington are fairly close together, this shouldn't be too much of an inconvenience. Further changes to IT systems are required to allow clinicians full access to records. The systems are currently integrated and there is some access allowed, but it's restricted and linked to services used across the Workington Primary Care Centre. So one of the priorities is to ensure that those IT systems allow full access for all clinicians. Yes, so the Clinical Commissioning Group think a merger of the contracts is the best way forward to enable all Workington practices to work fully collaboratively. That therefore they can build an integrated model that delivers a better patient experience for you. It'll certainly be bigger than we in Workington are used to, but it's comparable to practice lists in other areas. Patients still have access to a wide range of clinicians, including a wider range of specialists for many longer term conditions. It'll also support staff who behind the scenes are currently working often in very small and very stretched teams. So this is an issue across the county and indeed the country. Practice phone systems tend to be run on a traditional phone system. A new internet-based system allows practices to work collaboratively and means that anyone ringing in or out will be able to do so. Such systems allow phones to be connected to different teams when phones aren't answered as quickly as we'd like them to be. So it allows the system to be much more agile. Again, this will deliver a better patient experience for you and resolve some of the frustrations that I know you certainly have at times when trying to contact your practice. And it'll be one of the biggest concerns for patients is that they'll be able to contact their GPs. So hopefully this new system will deliver a better patient experience. Delivery of GP services changed a lot over the last 10 years, and it's well documented nationally that the number of people working in practice is reduced. GPs need access to a wider range of clinicians with very different expertise and skills mix, and a fully integrated approach offers more flexibility within practices. In Workington, we've struggled to recruit GPs who are able to commit to staying here, and nationally we know that many GPs want flexible working hours, want to work part-time or do some work in primary care and some in hospital to broaden their skills. So by making the offer more flexible, we hope to be able to recruit more successfully to Workington. So it's hoped that a fully integrated model will improve patient experience for you and service delivery. But we know that change will take time, so some of the changes will come quicker than others. But ultimately, the impact on you will be positive. Yes, of course, Workington GP's practice do work together currently, and you'll no doubt have accessed some of the services such as Workington Primary Care Centre, extended access appointments or the home visiting service. And of course, the wonderful vaccination programme that we've seen recently. If they didn't work together, they'd struggle to offer services effectively. But this is one of the reasons that they think formalising this agreement will result in better patient experience. Major barrier to collaborative working is IT systems and patient lists, having separate patient lists. By combining those patient lists and upgrading the IT systems should ultimately deliver a better experience to you. You will always have the opportunity to apply to move to a practice in a different area, but hopefully this new scheme, this new model will work for you. No one will ever be forced to see a clinician that they don't want to see. Reception staff follow very strict guidelines on triaging patients and allocating appointments. Patients would need to be mindful of this and advise reception staff, of course, if there are reasons for not seeing someone in particular. I hope that's answered some of your questions about the merger of the 5 Workington GP practices. But of course, as always, if you have any further questions, don't hesitate to email me at office@mark-jenkinson.co.uk.